Sometimes I think I'm the single voice in the industry telling you both sides of the coin. And today I'm going to ruffle some more feathers in my industry. But hi, I'm Christopher Westfall. I want to tell you both sides of the coin. Full, open transparency. Medicare Advantage or Original Medicare with a Medicare Supplement or Medigap plan. New information in the news this week, which is why I want to bring this to you today. There's a really in-depth study from the Kaiser Family Foundation, a nonprofit research firm that researches everything happening with health insurance in general. Again, it's not biased either way. They do a lot of information on Medicare, Medicare Advantage, Medicare Supplements, all of it. But their report that just came out the last week of June 2021 is really turning some eyes over there. And I want to share with you some takes on that, show you the actual report, and show you most importantly why, if you're looking for a Medicare plan, Medicare insurance of any kind, you're probably only getting half of the story. I'll prove that to you with research from another nonprofit that's also recent and relevant in the news. So today I want to share with you, this is from Health Payer Intelligence, their website. Now the highlights you're going to see on these articles, the highlights have come from me. They're not in the original article. I highlighted them to save time and bring you right to the most important part. This says, the title of their article is Medicare Supplemental Coverage is tied to fewer cost-related hurdles, and it's comparing Medicare Advantage if you went that route or if you stayed on Original Medicare and went with a supplement plan. It shows that 15% of the people on traditional Medicare who have a supplement said that they were experiencing healthcare related spending problems. Let me go in this, make it larger so you can see this. Medicare Advantage beneficiaries experience higher rates of problems related to healthcare spending compared to traditional Medicare beneficiaries who have Medicare supplemental coverage, according to a Kaiser Foundation brief. The number of Medicare Advantage members has increased in the last few years, despite that certain aspects of these private plans can lead to more spending-related problems. The KFF reported on the frequency of these problems, including trouble accessing care, which I've covered many times, delays in care due to costs, and issues with paying medical bills. Overall, traditional Medicare beneficiaries who did not have supplemental coverage experienced the highest rate of cost-related problems. Well, that's a given. With Original Medicare, you have to pay 20% of all your outpatient bills. Now, Original Medicare is great, but it doesn't pay all the bills. That's the problem, and there's this huge gaping hole with Part B. That's everything outpatient. As you know, more and more things have been moving outpatient. So there's a funny story that just came out from one of the major Medicare Advantage providers. It just came out today, and it's comparing saving money on Medicare Advantage versus being on Original Medicare. Well, that's like comparing the moon to a baseball. They're totally different things. Being on Original Medicare is great for the freedom and flexibility. You can go anywhere in the country that accepts Medicare, any doctor, any hospital. That's great. The problem is that 20% gap, and that's why Medigap insurance should be compared to Medicare Advantage for a more even comparison. 19% of Medicare beneficiaries reported encountering healthcare spending-related problems. 19%, 1 out of 5. And they're on them for multiple years, obviously. 15% of traditional Medicare beneficiaries reported problems. When singling out traditional Medicare members who had supplemental coverage, the number further drops to 12%. So 12%, and that's taking into account now the premiums, the co-pays, if any, and all that. So 19% of people with Medicare Advantage were reporting problems, 12% with supplements, all things considered. This pattern, it says, remained consistent even when the study considered additional factors. In beneficiaries who reported to be in fair or poor health, this is even worse. 39% of Medicare Advantage beneficiaries had problems. I've said it here before, I'll say it again. The only complaints we ever have from our Medicare Advantage people are when they're sick. They love the no premium. It's when they're sick that there's problems. And this is highlighting that finally in this study. Compared to 31% of people with traditional Medicare, no backstop whatsoever. And 27% of people with a traditional Medicare with supplemental coverage that are in poor health saying that they're having problems. They're probably having more problems than that, paying their bills all around. The results showed that traditional Medicare beneficiaries who had supplemental coverage had the most stability with their healthcare spending, indicating that supplemental coverage is a key component when it comes to receiving affordable healthcare. Now, this is Health Payer Intelligence. It's a magazine. It's online. This is the conclusion that they're drawing. If you want stability, then you're looking more at a thing like a Medicare Supplement plan, which has premiums for your Medicare Supplement that are like this. And eventually they do go up a little bit. On a Medicare Advantage plan, they start like this. They're zero, and then you have a massive spike even when you can hit your maximum out of pocket. So let's talk about the maximum out of pocket, because all the insurance agents that I know that push Medicare Advantage exclusively and never tell you about Medigap plans as an option, they all hide behind, yeah, Medicare Advantage is awesome because it has this max out of pocket. It's the same as Medicare, which it's not, but it has this max out of pocket, which is great because it protects you. It's not the same. It's not the same with your referrals required, your network limitations that are required, and the networks can change mid-year. You can't. And it's not the same with prior authorizations required for procedures to be done, and then you have to have those procedures in a network hospital for most Advantage plans. But I digress. Medicare Advantage plans, like traditional Medicare, generally impose cost-sharing requirements for covered services, subject to certain limits, such as daily co-payments for inpatient hospital stays or co-insurance for physician-administered drugs. You want to see a huge contrast? You want to see something massive that'll blow your mind? If you're on a Medicare Advantage plan or considering one, look at your summary of benefits for physician-administered drugs. Look at that real carefully. And what do you see? You'll see 20% of the cost has to come from you. Now, that's in the network if you get prior authorization, if you got a referral to go to that oncologist, if you played by the rules and got everything approved, you're still going to be out of pocket 20% of that cost on an Advantage plan, not a supplement, on an Advantage plan. How? The industry got that carved out of Medicare Advantage. They're like, whoa, that's a big cost. We don't want that. Let's put that back like it is on original Medicare, where the client has to pay 20%. But wait a minute, isn't the supplement and Medicare Advantage the same thing? No, not by a long shot. An Advantage plan is not another kind of supplement. It is a complete replacement for the Medicare rules. Medicare and a supplement go together. An Advantage plan is different. It's a Part C. It's a totally different regime. It's not Medicare. I'll prove that to you in the next one, next article here. So anyway, where were we? Medicare Advantage enrollees may incur thousands of dollars in out-of-pocket costs for covered benefits before reaching their plan's maximum out-of-pocket limit, the brief explained. For traditional Medicare enrollees who didn't leave Medicare, Medigap plans and Medicaid as supplemental coverage can cover deductibles and cost-sharing requirements, saving these members money in the long run. So let me just share with you what this means on the max out-of-pocket that all the agents are saying. This is why it's so much better to have a Medicare Advantage plan. But before I get to that, if you like any of the content in our videos, which I'm trying to be just truthful and honest where you're not seeing much in the insurance world, please do me a favor and hit the like button that's on this video. It really helps me out a lot and helps the algorithm so that more people can be exposed to it. And please share our information with someone who's maybe considering their choices when it comes to Medicare. Not everybody can have original Medicare and a Medicare supplement. I understand that. But those who want it should be able to have it and have the best price available. That's where my firm comes in. That's all we do. Here's our team. You can reach us. Our information's available above. But if you just like the video, and if you're not yet a subscriber, I encourage you to subscribe. So here's the Medicare Right Center and what they had to say about this same study. The Medicare Right Center is an advocacy firm, again, a nonprofit that looks at all things having to do with Medicare, and they reach out and help people that are on Medicare when they have major, major problems. And they look at a policy of Medicare and try to find ways that they can benefit seniors by changing it. Great organization. Their take on this is Medicare Advantage may expose enrollees to higher risk of cost-related problems. These cost-related problems can include trouble getting care, this is on Medicare Advantage, or experiencing delays in care, as well as problems paying medical bills. Now here's them saying this, not me. When people enroll in Medicare, they may choose between traditional Medicare or Medicare Advantage. That's their grammar fault there, to be this or that. It's either traditional Medicare or Medicare Advantage. Most beneficiaries in traditional Medicare have access to supplemental coverage, otherwise known as a Medigap plan. You can get that, such as Medicaid or Medigap, that covers the cost. Medicare Advantage plans, herein called MA plans, Medicare Advantage plans are private insurance that covers all the traditional Medicare benefits, and that means categories, not the exact same things, and often bundled together medical and drug coverage under one umbrella. It's a complete plan, they'll say. Tell you one, if I hear it one more time, I'll scream. If you hear somebody on television yelling at you saying, you need to get the benefits that you deserve, and it's free, with rainbows and unicorns all over the place, that you need to ask them if they have a bridge to sell you too when they tell you all that poppycock. I digress. Medicare Advantage plans continue their rise in popularity, fueled at least in part by significant advertising and new laws that allow the plans to create new supplemental benefits. One of the biggest selling points for Medicare Advantage has historically been its annual limit on out-of-pocket expenses, which ensures that people with very high bills have some protection against financial disaster. Isn't that great? This report, however, demonstrates that the existence of an out-of-pocket maximum does not guarantee that beneficiaries will find their care affordable, just because it has an out-of-pocket max. At the Medicare Rights Center, we are deeply concerned about this report, coupled with our concerns that they've said in the past about how Medicare is overpaying for Medicare Advantage plans, and the Medicare Advantage plan's history of inappropriately denying care. I've covered that before. You should see that on my website called allaboutmedicareadvantage.com. Pretty catchy, huh? Allaboutmedicareadvantage.com. On there, I detail this report that I'll link in the description below of this video when it's finally out. Office of Inspector General, again, not me, here's an independent dude. This report says Medicare Advantage appeal outcomes and audit findings raise concern about denial of service and payment denials. What's their concern? Their concern is that most seniors don't know that on Medicare Advantage, there are 5 levels of appeal that you can have. When they say no, they say no automatically in some cases. And just because they're saying no is not the end of the story. You need to appeal that. What happens when you appeal? The OIG found that when beneficiaries and providers appealed pre-authorization, really called prior authorization in the industry, and payment denials, Medicare Advantage organizations overturned 75% of their own denials, overturning approximately 216,000 denials each year. But if you didn't know to ask, you wouldn't have it overturned. Now, this is people asking for, begging for coverage on back surgery, pain, knee replacement, all those kind of things, routinely denied. And yet, if you know that you can appeal and you do exercise your right to appeal, it's overturned. Oh, it gets much better. This is the OIG report again that the Medicare Rights Center is pointing to. This has been their concern for years. During the same period, independent reviewers at higher levels of the appeals process overturned an additional denials in favor of the beneficiary. The high number of overturned denials raises concerns that some Medicare Advantage beneficiaries and providers were initially denied services and payments that should have been provided. This is especially concerning because beneficiaries and providers rarely use the appeals process, which is designed to ensure access to care and payment. I get excited about this because I hate the fact that seniors are getting ripped off, told that they're being sold a bill of goods. You have to read this because it exactly points to the reason why this is a problem, and that is because it's all about money. If you look at the very conclusion of this whole thing, it says the whole thing is all about money, and that's why they're denying care. But anyway, you can read that on your own time. I'm not going to bore you with it today. What I am going to show you before I show you the final Kaiser study is a recent interview that I did with one of our new clients who is researching his own path of what's he going to do when he turns 65. Now that he's there, what's he going to do? Medicare Advantage or Medicare Supplement? What's his choice? Well, he had some experience with his mom's plan, and here's just a snip of that interview.
Wife's mother passed a couple years ago. She had, what'd she have, ma'am?
Blue Cross Blue Shield Garnet Advantage.
Blue Cross Blue Shield Garnet Advantage. And we never really looked into that, you know, but all I do know, and she was very sick the last few years of her life. We went to the hospital many times. And every time we went, she would pay $1,500 on the credit card simply because she had to pay, her share was free.
Medicare Advantage, $300 per day on this particular plan. She, a senior, now in horrible health, now has to whip out the credit card for $1,500. Okay, just get that in your mind, because this is what happened to my grandmother. This is what led me down the road of finding out about these kind of plans.
$100 a day for the first 5 days, then they cover it. But the last year, we were in the hospital 5 nights.
Oh my.
So that cost her, you know, my goodness, it was just, but we didn't think of it, because me and Pam, we didn't know, we never even looked into Medicare. But that was an Advantage plan where she was paying a zero premium. But my goal, and what she clearly let be known is, you know, I want to know what's my bottom line. What is my worst case scenario?
I'll have that whole interview on our YouTube channel. Again, if you're not subscribed to it, I really encourage you to do that. So let me show you the study that caused all of this stir, and it's from the Kaiser Family Foundation. Here's the actual study. I'll just show you a couple of highlights, and then I'm going to show you why you don't get the other side of the story. I'm going to show you behind the scenes of what it is that you're given an option of. And senior after, I'm telling you, client after client after client has told me the same thing. Why is it that the other agents never showed me that there was another thing I could do? All they said was Medicare Advantage. Pick your Medicare Advantage plan. Sign the scope of appointment so I can sell you a Medicare Advantage plan. It's all going to be wonderful, unicorns, rainbows, and zero premium. They never showed them the other side of the house, which is Medicare with a Medigap plan. At least be fair and balanced and honest, like we are. So here's a study from Kaiser. Cost-related problems are less common among beneficiaries in traditional Medicare than in Medicare Advantage, mainly due to supplemental coverage. Hello. In recent years, the share of people going in Medicare Advantage, the private plans, the private health plan alternative to the traditional Medicare program, has grown substantially. In fact, in 2021, 42% of all Medicare beneficiaries were enrolled in Medicare Advantage, up from 22% before. If you've got agents that are only telling you about Medicare Advantage and it's on the television paying billions in advertising every day of the year, that might be, you know, in investigations as a detective, I would call that a clue. Maybe that's why. Interesting. Maybe that's why so many people are signed up for it, because they have so much money to push them in there. You can see this study. I'll link it below. I want you to see the conclusion, and I'll show you what the agents don't want you to see. These findings may run counter to expectations that, given that Medicare Advantage plans, unlike traditional Medicare, have out-of-pocket limits for Medicare-covered services, they may have reduced cost sharing for Medicare-covered services and often include vision, hearing, and dental services. Additionally, most Medicare Advantage enrollees pay no premium. Woo! Red flag. Beyond the monthly Part B premium required of all beneficiaries. In contrast, traditional Medicare beneficiaries pay premiums for Part D, typically. That's the standalone drug plan if you have a Medicare Supplement plan, and supplemental coverage, Medigap. However, Medicare Advantage plans, like traditional Medicare, generally impose cost-sharing requirements, certain limitations, and so forth, which means that Medicare Advantage enrollees may incur thousands of dollars in out-of-pocket costs for covered benefits before reaching their plan's maximum out-of-pocket. In contrast, the majority of traditional Medicare beneficiaries have supplemental coverage that covers some or most or all of their Medicare deductibles and cost-sharing requirements, helping to mitigate cost-related problems. For example, the most common Medigap plans cover nearly all cost sharing for Medicare services. And here's the big difference, folks. With original Medicare and a Medigap plan or a Medicare supplement, you can go to any doctor in the country that accepts Medicare. That's almost everybody. And you don't have to worry about a network. And you don't have to check with a hospital to see if they take Medicare. Pick the best one in your county and go. No prior authorization needed. If you want to go see a specialist and you need one, go. There's no referral required like there would be on your HMO plan. Analysis that focused more narrowly on the specific question of problems paying medical bills also showed higher rates of problems among Medicare Advantage enrollees than among adults age 65 or over than either traditional Medicare or private supplemental coverage or a standalone private health insurance plan. Higher rates of problems among Medicare Advantage. Now, I've never had a problem with my Medicare Advantage people until they were sick. Then there's a big old problem. Huge! Then they find out what they had. So this is a story that I promise you nobody else will show you. This is from the Commonwealth Fund, which is a nonprofit started by a lady when she passed away. She wanted somebody to study healthcare and benefit mankind by the study of healthcare policy. And this study is looking at, this is from 2021, how agents influence Medicare beneficiaries and their plan choices. How agents make a big impact on this. And it's true, they do. But agents should show you both sides of the story, not just one. And for some reason, and I know what the reason is because of the pay that we get, there's a huge incentive to sign somebody up on Medicare Advantage. And how hard is it? If you say, I don't want to be a salesman, I just want to help people, I'm going to sign them up on a zero premium plan. There you go. I helped you. I got you a plan for zero premium. Break my arm, pat myself on the back for what a good job I did getting you enrolled. I didn't sell you anything. I just got you enrolled in a plan that in some states is going to pay me over $750 just to get your signature on a piece of paper. And by the way, that's about triple what we would make if we sold you a Medicare supplement plan. But it's not about money. This is about people, right? Sure. So this study says the agent plan model can limit plan choice in ways that are not obvious to beneficiaries. Really? So they studied what's being shown by agents out there. Interesting. In their online portal. If you went to Medicare.gov, you can see all these plans. Well, let me make it bigger. All these plans right here. But they looked at 3 big online agency portals and you can't see all the plans. Why is that? That's interesting. Same thing with Medicare, with Part D plans. Here it is. As they looked at what the agents are offering online, results varied widely between tools and plan types, but all of the agent tools excluded some of the plans available. Furthermore, man, can I make this just bigger? I just really need to zoom in here so you can see that it's not just me saying, and all my clients telling me, why did that agent not share with me Medigap even existed? And all the agents that come to work with me say, that's funny, I was recruited into an agency, they never even told me anything about Medicare supplement plans. They just wanted me to sell and push Medicare Advantage. I wonder why. Here it is, right here. Furthermore, only one of these sites offered Medigap plans. Only one. And it includes less than 1/5 of the Medigap options. Available across the 5 counties. Isn't that interesting? Of all the sites out there to help seniors with Medicare, only one of the ones that they researched and found had anything showing about Medigap, Medicare Supplement. So do you think those agents are fair and balanced in what they're offering? This is why it's a problem. Because agents are telling you only one side of the story. Oh, you can't get, I've heard them. We were taught, they're saying. Oh, we were told, just tell the senior, you can't afford that. You can't afford those plans. Those plans are for rich people. No, they're not. This study says, regardless of the reason, the fact that agents do not contract with every carrier does not necessarily mean that people will not find a plan that works for them, nor does it mean that agents will not provide objective guidance. As one former broker manager said, quote, "We would instruct our staff in no uncertain terms that if they were using the tools and found a carrier that's better for them that we didn't carry, just give them a call on their toll-free number and tell them to call there." That's what we do. If we don't have a plan and it's best for the person, we'll tell that person how they can get that plan directly. But it's not that common. However, that's probably the person they talked to that was the one person that showed Medigap as an option. However, there is no explicit imperative or financial incentive for agents to behave that way. That's the truth. Agents are not required to disclose that they do not offer all available plans, and beneficiaries may not recognize that agents may not present all options available to them. That's why I have this channel on YouTube, to tell you that there are more choices, and my agency offers them. All of the choices. Patient advocate was quoted in the study saying, "It's a really complicated process, and when people come into it, they often don't even know what questions to ask." Well, let me give you a couple of them. And it really should start with that book, the Medicare and 𝐬𝐭 Guidebook, that is back there on my desk that I refer to all the time. That book shows you clearly the path. And this is very, very, very important. And I'll get to it really quickly, and I promise you, I'll let you go about your way. You have two choices. Here it is on the very front of the book. Show you from Medicare directly. You have Original Medicare or Medicare Advantage. On Original Medicare, you can go to any doctor or hospital that takes Medicare anywhere in the United States. Medicare Advantage, you'll need to use doctors who are in the plan's network. Ask your doctor if they participate in Medicare Advantage. Now, on the Original Medicare side, in most cases, you don't need a referral to see a specialist. Nope. On Medicare Advantage, you may need a referral to see a specialist. Okay, and then it talks about the rest of them. So there's a huge difference that if your agent has not even shown you that you could be on Original Medicare with a supplement, problem. So here are the three problems that they identify in the study. I'll show you this. Come on back up here. Problem number 3, beneficiaries may not understand their post-enrollment rights. Post-enrollment. So you sign up for a plan, you got a free plan, no premium with some agent who pushed it in front of your face saying, best thing since sliced bread. We'll give you a ride to the doctor. We'll give you Uber. We'll give you food. We'll give you a credit at the pharmacy. We'll pay you, and it's no problem, no cost whatsoever. Just don't get sick. Beneficiaries don't understand their post-enrollment rights. Ideally, beneficiaries will use the coverage to which they are entitled, but this is not always straightforward. One example is the appeals process for coverage denials. Oh my gosh, I've been talking about that for years. Patient advocates express concern that while it is fairly common for a plan to reverse a coverage decision upon appeal, actual appeals by beneficiaries are infrequent. They don't know they could appeal when they're denied care routinely on Medicare Advantage. So please let someone know if they're on a zero premium Medicare Advantage HMO, when they're denied care, they need to appeal. Hopefully they have a really good agent that can help them through that process. Beyond the information that beneficiaries need, advocates also express concern about policy changes to Medicare Advantage that do not have equivalents in traditional Medicare. See, here's the thing that they don't tell you also. Medicare Advantage is a 1-year, calendar year contract. Your max out-of-pocket protection expires December 31st. And if you know anybody that's had a major illness, the illnesses don't follow the calendar year. So if you have to pay 20% out of your pocket for your cancer treatment, for instance, happens all the time, you better have it all wrapped up by December 31st. Otherwise, when January 1st happens and you're paying $8,000 or $10,000, which would be out of your pocket, and you hit your max out of pocket, that's going to happen again early January. First, Medicare Advantage plans are permitted to offer non-medical benefits that are health-related, such as, here we go, transportation services, meal delivery. Second, regulations make it easier for Medicare beneficiaries to switch into They should make it easier. Into and within Medicare Advantage carriers and plans compared to switching into a Medicare supplement. See, a Medicare supplement plan, we can change your plan 365 times and days per year. You can change your Medicare supplement, your Medigap plan, from Plan F to Plan G, from Plan G to Plan N, from Plan N to Plan G, any time of the year you want to. In most states, it requires some health questions, but we're experts on that in my office. We can help you with that. So if you're on a Medicare supplement plan and you've not reviewed your rate in the last 3 years, my gosh, call the number and let our people review it for you. Our service doesn't cost anything, but we save people money every single day by doing that. You can do your Medicare supplement changes anytime you want. Advantage plans, one time per year. You take it or leave it, and the doctor that you pick based on the network to be your primary care doctor, because you need one in an HMO, that doctor may leave the plan off schedule because their calendar does not go to the same as Medicare Advantage calendar year calendar. So that's why there's always problems with hospitals coming and going, doctors and doctor networks leaving and coming back and negotiating and all that. Plus the benefits change every single year on Medicare Advantage plans. You can't sign up on a plan today and think, you know what, at 65 I'm signed up, it looks perfect, and think that you're going to get the same benefits by the time you're 67 or 68 or 70. Totally different, look like a totally different plan. Both features, supplemental benefits and easy plan switches, are simple for beneficiaries to understand and may take on disproportionate weight in decision making when compared with features that are harder to understand but that may have greater consequence, greater impact on their out-of-pocket costs, for instance. So it's easy to understand that they say that you have dental, vision, and hearing included in the plan, but most everybody never looks at what the details are on that. What is it? So I get 2 cleanings a year? Great. What if I need a crown? What if I need fillings? What if I need dentures? What if I need, what do you call that? An implant. Those things aren't covered on most of these plans. It's just a very superficial plan to check the box and say, oh, you got dental with that plan. You don't have dental with that Medigap plan, do you? Nope. See, this plan's better. And what this is saying is the supplemental benefits and easy plan switches every year, you can choose one different plan, are simple for beneficiaries to understand, but they take on disproportionate weight in decision making. I can't tell you how many times people say, yeah, I signed up for that free plan because it gave me dental coverage, or because it gave me silver sneakers. Well, how good is the silver sneakers if you can't afford the cancer coverage that they're restricting your access to? One oncologist that doesn't even speak English, that was the cheapest bidder, that's in your HMO network, that you can't even get on a schedule for a long time because you gave up everything for your silver sneakers. You know, I don't want to feel like I don't want you to think that I'm condemning anybody for any of the plans that you may or may not decide to get on. That's everybody's individual choice. I totally get that. Absolutely. And that's why we present both sides of the story. What I do want people to understand is you have choices. You can choose to be on a Medicare Advantage plan. If so, find an independent agent that does not work for one company so that they can guide you through what are available, but at the same time show you may not even understand that you can afford a Medicare supplement plan. Yes, you can afford the plan that lets you go anywhere, even if you decide to get a supplement plan and a standalone drug plan. The benefit there is if you get original Medicare, your Medicare supplement, and a standalone drug plan, that drug plan can be tailor-made or tailor-found to fit your list of drugs. If you're not taking a whole lot of drugs, which a lot of people are not, they're very healthy these days, get a very inexpensive drug plan, $6 or $7. If you're taking a lot of drugs, you can get a drug plan tailored more for your needs. What happens with Medicare Advantage plans off the shelf, they combine Medicare Advantage, that's what they call them MAPD in the industry, Medicare Advantage plus a Part D plan just joined together, and they're generic on their drug plan side. So they may cover some of your drugs, they may not, but guess what? You get what you get because it's all one plan. You see, it sounds good in the salesmanship when you're like, you can get all that in one plan. In reality, at the end of the day, people say, it may not be the best fit. What would be better in many cases is to have a supplement plan that pays for everything, lets you go anywhere without restrictions, and having a drug plan that's tailor-made for you. that's found in the marketplace. So you can only achieve that, in my humble opinion, by going through an independent agent that can offer all that stuff. And again, if we don't have the best plan for you and we can see it, that's there in the marketplace because we have access to seeing everything, we will refer you directly to that plan. Doesn't happen very often because we have a lot of great plans all across the country. Am I the final authority on Medicare? Heck no. I'm learning stuff every single day. Problems that people have, and I live vicariously through our more than 10,000 clients across the country and our hundreds and hundreds of contracted agents. Oh man, I wanted to show you one more thing before I go. On that last thing there where it was the nonprofit that was talking about how agents are paid and compensated and all that good stuff, at the very bottom of that link, I'll leave it in the description, one of the places where they took that information was from How to Become a Medicare Agent, written by a friend of mine. It was an article written by Brandon Clay. And on that page, if you scroll all the way down from Redbird Agents, it says How to Become a Medicare Agent. Look at the training by Chris Westfall. That's me. It's funny how this nonprofit linked to an article where in the article it says, get your Medicare training from me, because we have a separate site that trains agents from across the country. Anyway, I hope this has been of some value to you. Lots of changes coming for 2022 that we'll be talking about here as we get toward the fall. We'll be helping all of our clients through this process. And if you know anybody that's struggling with their Medicare insurance, please have them go to our website for the education, and also call us if they have a decision that needs to be made. I promise you this will be unbiased in what we give them as an alternative, and we can help them through the process, even if they're wondering, should I start on Medicare? A lot of people are working much longer than they ever did before. So whether or not they should even leave the employer plan or get Medicare coverage at all is a big question that we answer every day. And to get that process started, you can go to a website that I started called howtostartmedicare.com. Interesting. Howtostartmedicare.com. That helps you apply for Part B and all that kind of good stuff. I'm Chris Westfall. Thanks so much for watching. God bless you and have a great day. Please share this information with somebody out there. Take care.